Hello, my name is Natalie Hemmerich, and I'm pleased to moderate today's webinar about the FDA's responses to the e-cigarette epidemic, and more specifically, this past year's retail Juul Blitz. Briefly, we here at the Public Health Law Center are located in St. Paul, Minnesota, and we have been one of the go-to resources for public health law and policy for nearly 20 years. We provide legal technical assistance, which includes resources and publications, policy drafting, and webinars like this one. All of the work that we do is done in consideration of advancing equity. What that means is that we are focused on partnering with communities and organizations to use the power of law and policy in a way that addresses the social determinants of health and meets the specific needs of all communities, especially those who unfairly bear a greater burden of public health and other societal harms. Here's the agenda for this mini webinar. Now I'll turn it over to Desmond Jenson. Desmond is a senior staff attorney here at the center, and most of his time is devoted to working on the FDA's regulation of tobacco products.
All right, thanks, Natalie. The use of Juul among youth and young adults is an epidemic, according to the Surgeon General and the Commissioner of the FDA. And those are people who don't throw that term around casually. I'm sure most people on the webinar are familiar with Juul, but I want to spend just a minute looking at Juul from a slightly different angle. You've probably seen an e-cigarette market share graph before, which seems to be the focus when discussing Juul's dominance. I think this is unhelpful at best and misleading at worst. Juul is on top, but that doesn't really tell you the whole story. Market share is only really useful if a market is stagnant or has slow, steady growth. It's a useless measure for the e-cigarette market in 2019. So let's start farther back. This chart starts in November of 2013, which is over 5 years ago. This is what the e-cigarette market looked like from late 2013 through the summer of 2016. So this chart stops when the FDA starts regulating e-cigarettes, as the deeming rule was effective on August 8th, 2016. This is monthly sales according to Nielsen data. This chart and the next few slides are going to have this blue area representing all e-cigarette sales in Nielsen's tracked channels. So this is all of the companies put together, including Juul. Sales hovered right around $50 million per month during this period. Juul was first introduced to the market in June of 2015, but during this time period, Juul sales are insignificant. So this chart gives you a good baseline to analyze the changes that come later. I also want to highlight for you that during this period of time, the e-cigarette market wasn't really growing all that quickly, if at all. There was a growth prior to this period, but for about 2.5 years, starting in late 2013, e-cigarette sales had essentially plateaued. Not terribly long after the deeming regulation was effective, Juul started growing very quickly. Its sales are in red, and you can see that as Juul grew, so did the entire e-cigarette market. It's important that the height of the blue area at any given point related to the red area is the same. So that shows you that the other companies that make up the market aren't growing. Their sales are steady. The growth of the market total is entirely Juul. I've included the black dotted line marking the deeming regulation on this chart, and we should mention here that starting on that date, all e-cigarette sales are technically illegal. The Tobacco Control Act requires pre-market review of all tobacco products, and because e-cigarettes had never been regulated before that date, no products could have received the agency's authorization prior to the effective date. Since that date, the FDA has been using enforcement discretion. That is, not removing products from the market that haven't received authorization. Instead, the agency is allowing them to be sold. We'll talk about it a little more later, but just be aware that the FDA could change its mind and end its use of discretion at any point. But back to sales, you can see the Juul went from nothing to about $50 million in sales per month in a year and a half, and that growth doubled the market, which was sitting at about 50 million per month, and then rose to over 100 million per month. Again, Juul's growth didn't come from taking sales away from other companies. It was expanding the market to new customers. So that's why we're looking at raw sales rather than market share. Market share misses that level of nuance. So let's add 12 more months of data. This includes all of 2018. This is what an epidemic looks like. This is why market share is irrelevant. Market share doesn't show you that after Juul entered the market, there was a 6-fold increase in the e-cigarette market over the course of 2 years. It's obvious to me that Juul was able to do something that no other e-cigarette brand had been able to do before. Looking at market share data makes it look like Juul is just taking sales away from Altria, Reynolds, and the rest, but that isn't the case at all. They're outperforming their competitors to an incredible scale. And the companies that they're outselling have been manufacturing and marketing tobacco products for decades. So ask yourself this question: what is it that Juul did that no one else had done before? Well, we know that Juul's growth has exploded in the last year, and we also know from multiple large surveys that youth use of e-cigarettes has similarly exploded. And that's why many have concluded that Juul's new customers are youth and young adults who weren't using tobacco products before. We can throw other companies on the chart as well. Sales by the other big e-cigarette manufacturers are steady. You can see a little blip for Imperial in May of 2018, actually as a result of the introduction of its Juul knockoff. But other than that, sales are steady for everyone but Juul, and Juul's growth has not slowed down. We need to stop talking about market share because it isn't Juul's market share that matters. It's the fact that they found customers who weren't buying e-cigarettes before, and the vast majority of them are youth and young adults. I hope that you are as alarmed by this as I am. If you take away one thing from this mini webinar, let it be this: nothing that anyone has done yet has slowed Juul's growth down at all. State and local governments have acted, school districts and parents have done what they can, lawsuits have been filed against Juul, including some by Juul users. The Surgeon General has issued an advisory, and so far these actions haven't changed the trajectory of this epidemic. And on their own, they really can't because of their limited scope. What could really turn the tide is FDA action. The FDA has an incredibly powerful tool at its disposal, which I mentioned earlier, that it has yet to use. The FDA could end its use of enforcement discretion and remove Juul's products and knockoffs from the market. That could have a major impact on the epidemic immediately. So what we want to talk about today is one particular FDA action related to Juul. I'm sure if you're attending this webinar, you're familiar with this. The FDA announced an historic action last September. As a close follower of the Center for Tobacco Products, I was very interested in this. I can tell you that the FDA is very careful with the language that the agency uses, and I noticed immediately that they're claiming that this was the largest coordinated enforcement effort in FDA's history, and that's over 100 years of history. So that's a bold claim, and it's one that's worth analyzing. After doing a ton of analysis, I found a lot of things that were worth sharing more broadly, hence this webinar. But before we dig into our findings, I want to make sure that everyone understands what the FDA does at the retail level. And we'll go through that as quickly as we can so we can get to the findings. Retail enforcement is an important part of the FDA's tobacco regulatory program. I'm guessing that most of you know that the FDA enforces federal requirements on the sale of tobacco products, which I've got on the slide here. And there's over 380,000 stores in all 50 states, the District of Columbia, and the territories. So that's a huge task, and it's worth noting that the FDA has been given a very big job. In fact, a lot of the FDA's resources go to retail enforcement. The budget for the Center for Tobacco Products for the fiscal year that started last October is $712 million. And according to the FDA's website, about half of that goes to retail inspections. I need to mention here that for the rest of the webinar, I'm going to be talking about fiscal years rather than calendar years, and I don't want to confuse you. The FDA reports data by fiscal year, so it's easier to analyze it that way, and it'll make some of our analysis clear. So from here on out, if I mention a year, I'm talking about the fiscal year, not the calendar year. So for example, fiscal year 2018 is October 1st, 2017 through September 30th of 2018. Hopefully that won't be confusing. Okay. This is just a screenshot of the FDA's website, but I want to show you that the money that's spent on retail enforcement is actually spent on contractors who conduct the inspections. The FDA doesn't send FDA employees into stores. The FDA's current state contracts are listed on its website, so you can go look at who has the contract in your state. In many states, it's a state agency. In other states, it's a private contractor. Those contractors conduct two types of retail inspections. One of these is called an advertising and labeling inspection, where an inspector is looking at the way the products are sold and displayed. So he or she is looking for things like vending machines, self-service displays, and warning labels. We won't be discussing those extensively. We will be discussing undercover buy inspections, which are exactly what they sound like. This is a lot to look at, but it's the FDA's diagram for how undercover buy inspections work. It's a complex process, but to boil it down to the simplest terms, the inspectors work with minors who are trained to do the undercover buys. They go into stores and attempt to buy tobacco products. The inspectors send the results of the inspection back to the FDA in Maryland, and then staff at the Center for Tobacco Products look at the information and decide what to do. A first violation gets a warning letter, and repeated violations are subject to civil monetary penalties. We're just going to call those fines today. Retailers can also receive what's called a no tobacco sales order. This is the FDA's penalty structure for repeated violations. The dollar amounts are adjusted upwards every year, which is why they seem sort of odd and random. On the whole, it's fairly straightforward. If a retailer has a first violation, they aren't subject to any fines. They just get a warning letter. If they have an additional violation, then they are subject to fines, and those fines go up with repeated violations. There's a little bit of nuance worth discussion. If an undercover minor is illegally sold a tobacco product and a retailer fails to check an ID in the same inspection, that's actually 2 violations. Now, from what I've seen, in that case, if it's the retailer's first 2 violations, the FDA will actually send out a warning letter, even though there are 2 violations. However, if that retailer has an additional single violation, that would actually be counted as the 3rd. So they would jump right to the $570 fine if it happens within 24 months of the first 2 violations. It's actually fairly common in looking at the compliance data to see a failure to check an ID and a sale to a minor in the same inspection. So these fines actually can escalate fairly quickly. I don't have the schedule up for no tobacco sales orders because they're counted in a more convoluted fashion that's kind of unintuitive and actually problematic, but that's a topic for another day. No tobacco sales orders are really important, and the strange method of counting them is a missed opportunity. We aren't going to be discussing them much, but the FDA has issued over 100 no tobacco sales orders at this point. The average no tobacco sales order is about 23 to 24 days. A couple of retailers have actually received multiple no tobacco sales orders, which means they get one that's longer, and the longest was 180 days. The FDA also has the authority to pursue a permanent no tobacco sales order, which would stop a retailer from ever selling tobacco products, but that hasn't happened yet. Okay, hopefully this all makes sense. But very quickly, I want to show you where I got all this information we're going to be looking at, because what I'm going to be showing you is all analysis of public information. If the FDA has some additional information that debunks any of our findings, it wasn't out there for us to examine. The FDA makes all of its retail inspection data available on its website, so you can feel free to look up your zip code and see how well retailers are doing near you. If you're like me and you want to look at all of the information, you can actually export all of the data by fiscal year, put it into Microsoft Excel, and do your analysis. I genuinely appreciate the level of transparency with respect to this process. And I should say here that the Juul Blitz enforcement actions we're going to be talking about are in this data set. So there's no reason for us to doubt that all of the inspections related to that are also in the data set. For a couple of slides, I'm going to use data from another part of the FDA's website. It's called FDA Track. It provides information on various FDA activities throughout all the FDA's different centers. And there's a couple of things that the Center for Tobacco Products tracks that are useful for what we're doing today. One more data source is the FDA's website that houses the data for the Juul Enforcement Blitz. There's a table at the bottom listing 62 enforcement actions from April through June, and then a spreadsheet you can download with 1,300 enforcement actions from June through September. So here is all of the 1,362 enforcement actions that the FDA identifies as being part of the Juul Blitz. I want to mention here that it's fortuitous for our analysis that the Blitz ended in September, which is the last month of the fiscal year. So that means that the entire Juul Blitz happened in fiscal year 2018. And because the deeming rule was effective for all of fiscal year 2017, that means we can compare fiscal years 2017 and 18 rather nicely, because for the entirety of those 2 fiscal years, the FDA was conducting inspections for not just cigarettes and smokeless tobacco, but cigars and e-cigarettes as well. So because of that, we can use fiscal year 2017 as a benchmark to examine the historic nature of the 2018 Juul Enforcement Blitz. So to evaluate this action, we'll look at actions related to e-cigarettes specifically, as that's the focus of the Blitz. But I think it's a fair assumption that the aggregate numbers for the 2018 fiscal year should also stand out in some way. And given that expectation, this is a strange outcome. This is data from FDA Track, but the enforcement database backs this up. You can see here each bar represents the total number of retail inspections that the FDA conducted each fiscal year. And the FDA actually conducted far fewer retail inspections in fiscal year 2018 than it did in fiscal year 2017. You have to actually go back to fiscal year 2014 to find a year that the FDA conducted fewer inspections. There had been a steady upward trajectory until this past year. Okay, don't try to read the information on the slide. I'm actually just giving you a peek behind the curtain of my data analysis because I want to flag for you here that I have no idea why there were so few retail inspections in fiscal year 2018. There's not some big reveal later on in the webinar explaining what caused that. I looked at this data from every angle I could think of. This is just one of many spreadsheets that I made to do the analysis. I just wanted you to know that I was thorough and I take this very seriously. I looked at how inspections and enforcement actions broke down by time, by state, by product, by everything I could think of that would work with this data set. And there's just no way to answer the question, why did the FDA conduct far fewer retail inspections in fiscal year 2018? I don't have the answer to that question, but I do have a lot of other interesting findings to show you. If you look at fiscal year 2017 and 2018 again, and you look at the monthly totals, so not in the aggregate, you can see pretty clearly that at the beginning of fiscal year 2018, the FDA was conducting far fewer inspections than normal. And then you can see the Blitz at the end of the year, but the Blitz inspections aren't enough to overcome the huge deficit in inspections at the beginning of the fiscal year. And that's why the FDA ends up conducting about 22,000 fewer retail inspections in fiscal year 2018. Again, we can see when the FDA was conducting fewer inspections, we just don't know why. I also want to flag here, unfortunately, we can't break inspections down by product category. That data isn't available from the FDA, which is really unfortunate. When nothing is sold to a minor in an inspection, the data set doesn't tell you what product they attempted to buy. It would be super useful to be able to compare compliance rates across product categories. If the FDA isn't collecting that information, that would be a huge missed opportunity. I only know that the data isn't available. Okay, in my opinion, this massive decrease in inspections is a big deal all by itself. We actually have a lot more to look at. Fewer inspections will inevitably lead to fewer enforcement actions if compliance rates are steady, which they tend to be for aggregate numbers. So it's not really surprising that in fiscal year 2018, the FDA sent out 400 fewer warning letters and issued almost 2,000 fewer fines than in fiscal year 2017. So here and on the next couple of slides, you're going to see cumulative numbers for the fiscal year. So the actions will stack up as you move through the months. If you try to look at the data month by month, the trends are a lot harder to see because the numbers kind of jump up and down. But in the aggregate, the trends are clear. So we also plotted warning letters and fines separately. So just be aware that the scale is different on each graph. We're not trying to be misleading. It's just easier to see what's going on with two separate graphs instead of one that's combined. The FDA highlighted its e-cigarette enforcement with the Blitz. So we should definitely look at enforcement actions related to e-cigarettes by themselves. The FDA issued more fines, but fewer warning letters for e-cigarettes in fiscal year 2018 versus 2017. Now, I'm trying to be as comprehensive as possible, so I'm including the fines for e-cigarettes, but that actually requires some explanation. Because as you can see, the fiscal year 2017 numbers seem a little off. If you notice, that green line just sits at 0 for the first half of the fiscal year. This is another situation where we can tell something out of the ordinary happened, but can't fully explain it. There's a lot here on the slide, but you only need to focus on the portion that I've circled. For fiscal year 2017, there were no fines issued for e-cigarettes and cigars until April. And then there was only a trickle until the last couple of months of the fiscal year. I'm not going to show you the warning letter numbers, but you'll have to believe me that throughout fiscal year 2017, the warning letter numbers were steady for all products. So the lack of fines is not the result of there not being inspections, and nor is it explained by retailer compliance. What we expect to see here is that some retailers who failed an inspection in fiscal year 2016 were inspected and failed again in fiscal year 2017, and they should receive a fine rather than a warning letter. What this data shows us is that all of the retailers who failed an inspection in the beginning of fiscal year 2017 were either compliant in 2016 or not inspected at all. But this strangely only applies to inspections where minors were sent to buy cigars and e-cigarettes. It isn't true for inspections where minors attempted to buy cigarettes and smokeless tobacco. And this isn't due to the FDA starting to inspect cigar stores and vape shops, because 99% of the retailers that received warning letters in fiscal year 2017 are convenience stores. So the point here is that something odd is going on, and that means that fines are kind of the only place where we have a bad benchmark to compare fiscal year 2017 and 2018. we're really actually still trying to figure this out. And if we do explain it, we'll definitely follow up on this. But for now, the focus is warning letters. You can see that as the fiscal year progresses, the warning letter deficiency grows until the FDA starts its Juul enforcement blitz, which is highlighted in yellow. By June, the FDA had issued 893 fewer warning letters in fiscal year 2018 than it had in fiscal year 2017, which I'm estimating means that at that point they conducted maybe between 4,000 to 6,000 fewer inspections for e-cigarettes. You can also see that by the height of the blitz in August, fiscal year 2018 almost caught up to fiscal year 2017. But the FDA finished the year with fewer warning letters than fiscal year 2017. So when you look at the data this way, the FDA's action doesn't look particularly historic, but this isn't the whole story. It's pretty clear that the FDA was doing more e-cigarette enforcement during the Juul blitz. If you look at the number of warning letters for e-cigarettes that went out during that period of time, it's significantly higher than any of fiscal year 2017 and the rest of fiscal year 2018. In addition, you'll have to follow me into the weeds for a minute, but the blitz warning letters were going out exceptionally fast. Don't try to scan through all these numbers because I've color-coded this table for you to give you a shortcut. What you're looking at is the average number of days it takes the FDA to send out a warning letter from the date a retailer is inspected until a decision is made, by month and by product. Darker boxes represent a longer delay in action. I've split the FDA's 2018 e-cigarette enforcement between the Juul blitz and the regular enforcement, and you can see there is a stark difference. So, in addition to conducting more inspections during the blitz period, the FDA was also doing everything very quickly. Some of these actions turned around in a day or two. So, this activity was definitely different than what the FDA normally does. However, you may have noticed that it appears that because they spent significant resources on the Juul blitz, it seems like it slowed down their enforcement, as warning letters for the latter half of fiscal year 2018 were going out much slower than fiscal year 2017 for everything except the Juul blitz. So I don't think there's any question that the Juul blitz was different in character than what the FDA normally does. But the question we want to answer is, was this historic? So there's a lot to look at here, but this is the monthly inspection totals by product for fiscal years 2017 and 2018, and this isn't cumulative. So numbers are going to go up and down by the month. But remember, our benchmark is fiscal year 2018 e-cigarette enforcement. So that's the dark blue line with the familiar increase at the end of the year. You can see that the fiscal year 2017 cigarette enforcement numbers, that's the top black line, is consistently ahead of the Juul blitz except for 1 month. The cigar numbers from fiscal year 2018, the same period as the Juul blitz, the dark red line, are also consistently higher every month and through the blitz period. Again, the FDA wasn't turning these actions around as quickly as the Juul blitz, but there's no question that the agency has done this level of enforcement before. I should mention that we asked the FDA about our findings and the historic nature of the agency's action, and we were essentially told that the blitz was an action that was incomparable to other FDA actions. They didn't offer us a different way to interpret our findings. But I want to highlight one more thing before we wrap up. On the left is an email that I received, that I'm sure many of you also received, announcing the September blitz. It's important that the FDA has singled out Juul by name. This is not something that the agency often does. They've also singled out a few other brands here, but this email on the FDA's website consistently identified Juul. On the right, you'll notice that Juul's name is in the title, in addition to being used 2 other times on the page that hosts the data on the blitz. In this case, the other brands are just relegated to other. I think it's a fair statement to say that the FDA is saying that it has deliberately targeted Juul. In my opinion, given what we know, targeting Juul is a good thing. We genuinely appreciate the fact that the Commissioner and Director Zeller are calling out Juul and acknowledging that we have a very bad actor. Except there's a major problem here. The enforcement blitz that literally has Juul's name all over it was not really all that focused on Juul. Only 17% of the enforcement actions were related to Juul. Given what we know about Juul, it makes little sense that Juul wasn't the major, if not the sole focus of this effort. There are certainly reasons you would want to send minors in to buy other brands as well. Juul is generally more expensive than other brands, and youth are the most price-sensitive consumers. But we know that this epidemic is being driven by Juul, and on top of that, it's the FDA's stated focus. The other important question that we should ask is, what impact did any of the FDA's actions have? And we already know the answer to that question. This is where the Blitz and other FDA actions line up with Juul's sales. The agency's actions have not put a dent in Juul's growth. I'll just reiterate that the starting date of the deeming regulation, again, the dotted black line, since then, the FDA has been using its enforcement discretion to allow e-cigarette manufacturers to sell their products without the required authorization. If the FDA chose to, it could end the use of that discretion and remove every single one of Juul's products and Juul knockoffs from the market immediately. One last note for you on this topic. As you may know, e-cigarette use is on the rise among youth and young adults. These are the usage rates for high school students according to the National Youth Tobacco Survey. The bars are proportional in height to their percentages, but what I want to show you is how the timing of the survey overlays with the rise of Juul. So each bar sits on the timeline for roughly the time that the survey was in the field, which is February through June of each year. The 2018 numbers showed a staggering increase in usage by high school students, but as you can see, Juul sales continued to increase after the survey was completed. It's also important to note that the NYTS explains to survey participants what an e-cigarette is, and it lists a few example brands, but in the past it has not listed Juul. Now that's important because if you talk to youth about e-cigarettes, you probably already know this, but there are many of them that would answer no to the question, do you use e-cigarettes? And some would even answer no to the question, do you vape? But those same youth would answer yes to the question, do you Juul or do you use Juul? Now the next data collection will begin next month, and I've heard that Juul will be listed as one of the sample brands. And when you combine that with the fact that there are now dozens of Juul knockoffs from the large manufacturers and small manufacturers that only sell over the internet and aren't captured in the Nielsen data, I will predict that unless the FDA takes a drastic step, which is removing Juul from the market and knockoff products from the market as well, high school e-cigarette usage rates will rise to 30% or higher the next time we see the NYTS numbers. Commissioner Gottlieb stated last Friday that if youth use continues to rise and we see significant increases in use in 2019, on top of the dramatic rise in 2018, the entire category will face an existential threat, which is a reference to the FDA ending its enforcement discretion and removing products from the market. We completely appreciate the fact that the commissioner is putting this idea on the table. Again, the fact that the commissioner recognizes the source of the problem and the most effective solution is ideal. However, waiting to act for another year or even 6 months to find out that youth usage has continued to rise when we all know that it will is taking an unnecessary gamble with the health of our nation's young people. It is time for the FDA to act. All right, I'm going to ask Natalie if we have a question or two that I can answer quickly, recognizing that we won't have time to get to all of them, but we are doing a follow-up webinar next month, and the focus will be on what the FDA can do about youth e-cigarette epidemic. And we're going to try to answer some of your questions today on that webinar, and we should have more time to answer additional questions then as well. So save the date for February 26th at 12 Central.
Thanks, Desmond. The other point is that you can always reach out to us with questions individually, and we can answer them that way as well. Real quick, we have one quick question, and it's sort of about the last thing that you mentioned, that the Nielsen data doesn't include online sales. Does any of the data from FDA include online attempts to buy? And if not, do you know how the FDA does that or tracks that?
That's a good question. So the data set that we're looking at, the retail inspections, are actually the brick and mortar inspections. The FDA has a separate database where it tracks all of its enforcement actions related to online retailers. And I don't know, I don't think this is the case, but I would have to actually look at it to verify. I don't think that it has data on when they attempt to buy and are unsuccessful. I think it actually only has enforcement actions, which are warning letters and fines. But it's a different data set. So the data that we're looking at is just brick and mortar retailers.
Thank you, Desmond.
Do we have time for one more?
No? I think we're at time.
Okay, we're at time, so we're going to stop for today. Again, hopefully you'll join us for the next webinar. We're going to try and save a lot more time for questions. And again, if there are questions in the meantime, feel free to reach out to any one of us. So thank you and have a good day.